This is Joe Freudenberger, CEO for OakBend Medical Center in Richmond, Texas, coming to you today with a Cup of Joe conversation about healthcare topics, some of which we don't all know, and sometimes we need to know it. I'm joined again by AJ Jimenez, who is our nurse practitioner in our wound care department. Our wound care department does amazing things, and I don't think we always know when we should be reaching out. And I've had some surgical procedures where my wife has said, you need to talk to your wound care team because this wound does not look good. So we are sitting here in Wound Care Awareness Month. It's so nice that we have a month for every known medical condition that there is. So let's talk about wounds. What are we talking about? I mean, a scratch, is that a wound? I mean, what looks like a wound that somebody should be thinking about, this may need some medical attention, and go from there.
Yeah, well, thanks for having me back again.
It's a pleasure.
I'm glad I made the cut.
11 years in wound care, that's impressive.
So wounds are, it can be anything. The most that we see in clinic are going to be your arterial diabetic foot ulcers, venous ulcers, pressure injury ulcers, and wounds that occur from surgical sites. But you're not only, those are things that we see in clinic all the time. Sometimes when you're in the ER, you do see some dog bites. You can see some boils that open up after some time. You can see injuries that happen from traumatic injuries that can occur. And so those are a little less common than the ones that we see typically on a daily basis in our clinic.
So for those of us who are not diabetic, diabetic foot ulcers is not something I'm worried about, and there are a lot of people out there that are like me that have surgical procedures. And the wound doesn't seem to be healing as fast as I'd like it to heal. Is that something it's appropriate for me to come into a wound care clinic such as yours?
Of course, yeah. I would say the first thing you would do is see the surgeon who you work with. I personally dealt with the same things in the past. Typically, sometimes what you're going to see is increased pain. You might see some drainage from the wound itself. You might see some redness around the site. And those are concerning signs, including systemic signs like fever. Those are clues that you might need to go see your surgeon first, and then that wound may require further assistance to get to a point where we can heal it.
So the interesting thing for me is, I had some back procedures and I had some wounds on my back. I couldn't see them, but my wife was looking at them and said, these don't look good.
Of course.
My surgeon wasn't available. He was out of the country. So what do you do in those circumstances? I don't want to go into an emergency department. I don't have a fever or any other indicators I got a serious problem, but I'm not looking at the wound either.
Right. So I think at that time you can talk to your primary care. Would be one of the avenues that you can take. There's also urgent cares that are available. I wouldn't say to the point where they are treating the wound itself, but they can refer you to a wound care center where you can get the appropriate help that you need.
Okay, so let's talk about that, because I go and see my doctor, whether it's my surgeon or it's my primary care doctor. They're not in the business of treating wounds, are they?
It depends. It depends if the surgeon is comfortable with that. I would say that a lot of surgeons are, but specifically in our clinic, we do have some surgeons that come see patients in our clinic that have surgical wounds that are comfortable treating them. Now, some other surgeons may not feel that way, or you might see them because they might refer them to you because they're not comfortable seeing them, and that's how we end up seeing surgical patients in a wound care center.
So you are treating a lot of wounds, and so what distinguishes the kind of care that you provide versus the kind of care that I might get in my primary care physician's office? Because a lot of primary care doctors are going to be comfortable treating a wound to some degree. But there's a higher level where a wound care clinic like yours becomes a valuable tool.
Right. So I think where we come into play is that we have different modalities in the way we can treat a wound. For example, we have wound vacs. We have another device called a PICO, which is similar to a wound vac. We have
a wound vac. What is a wound vac?
So it's like short for wound vacuum. So it's a sponge that goes into the wound itself and absorbs whatever does not need to be into the wound, and that's changed 3 times a week. So we have different ways that we treat wounds that may not be a modality that is seen in a primary care office that we can use. Another thing I wanted to add was skin substitutes is something that we use in our clinic.
Okay.
And so you have to jump through some hoops with insurance in order to get to that point. But those are some of the things that we do to treat wounds in our clinic.
Okay. So a slow to heal wound, what does that mean? I mean, is that obviously the day after surgery, that's not slow to heal. So is it 2 weeks later, 3 weeks later, slow to heal? I mean, what constitutes slow to heal?
What constitutes a slow to heal wound is just a wound that over time is just not doing well. It's not looking good.
Gotcha.
So that's saying that kind of brings another topic of conversation where patients need to be compliant in regards to going back to their surgeon.
Gotcha.
For example, you had back surgery, it didn't look great. Then at that point, when things are not looking good, then that's when you start finding other avenues to get that wound to heal.
Okay. Well, let's switch back to the more common, because you deal with a lot of diabetic foot ulcers. So there are a lot of diabetic folks out there.
Yeah.
What should they be looking for? When do they want to go see the wound care experts?
So diabetics really, they need to keep an eye on their feet for in the beginning stages, right? A lot of people have neuropathy and they don't have a feeling, a sensation of what's going on there. By the time we get to see them, they might have had an injury where a nail got through their toe and they had no idea about it. And so what we recommend is just to do daily inspections. And when you start seeing something, that's starting to form like a blister or like a redness in the skin, especially if you're diabetic, is to see the podiatrist, and in turn, eventually will probably come and see us at the wound care center.
Okay. So why is, you talk about getting it early. Why is that so important to get it early?
Mainly to prevent complications. And the biggest thing that we see is amputations.
Okay. I don't want to lose my foot.
You don't want to lose your
toes or anything else like that.
You don't want to lose your toes. You don't want to be in the hospital long term with antibiotics. You want to decrease the length of stay in the hospital, and you want a good outcome for yourself, right? Amputation is the worst thing that can happen, and so not only that, you can have infections that linger on for so long, and they create a quality of life impedance over time.
Okay. Are there things that cause a wound to become slow to heal? Are there, like, if other than diabetes, if I have certain conditions, if a person is a smoker or a drinker, or what are the things that might cause wounds to be slow to heal besides diabetes?
Besides diabetes, some of the things that we commonly see are patients who smoke. They have a hard time healing. Patients who have immunologic issues where their immune system is depressed, maybe because of a prior transplant from a prior surgery. I've seen that before. Radiation injuries from cancer is actually one of the reasons why wounds can be caused. And then I had some other ones, but paralyzed patients. So patients who are paralyzed, lay in bed for so long, or prolonged hospitalizations can cause issues with pressure injuries.
Well, that would cause an injury. I guess where I was coming from is, if I'm, for example, going into surgery, I want my skin to be as prepared to heal as possible. So what sort of things might I consider doing in advance of surgery to ensure that post-surgically I'm ready to heal up?
Good hygiene,
okay,
and inspecting your skin.
And if a person, I don't smoke, so if a person's a smoker, they may want to cut back on their smoking or cut out their smoking.
Cut back or just
totally and I've heard this a lot, but why does that prevent your skin from healing properly or slow it down?
Yeah, so from my experience, what I've seen so far is that when smoking, it can cause calcified arteries, and because you have calcifications in those arteries, it can decrease blood flow to those wounds, which can in turn cause that wound to be slow to heal.
Okay. Any other indicators that would be something I should be aware of before I go into surgery that might help me post-surgically from a skin standpoint?
I would say, if you've had a history of wounds that have had a hard time healing, or wounds that just, take a long time to heal, might be something you speak with your doc before doing something like that. Okay.
And can you share a success story, something that kind of sticks in your mind as to what wound care offers that will kind of bring it all home for us and help us understand the value of this particular tool?
Yeah, so we had a patient that came into the ER here. It happened to be on a day where one of our podiatrists was in clinic, and we went to go see the patient in the ER. Decided that the patient needed to be admitted, needed surgical intervention. That all happened. He came to our wound care center, was compliant. Actually went into the hyperbaric chamber as well, and ended up healing, went back to work.
Okay.
Which was
so hyperbaric chamber, we haven't talked about that. What is that? How does it work?
Hyperbaric chamber is similar to mimicking diving underwater,
Okay.
about 33 feet. And what it is providing your body with 100% pressurized oxygen,
Okay.
as opposed to oxygen that you would breathe without being inside the chamber. And so what that does, it drives oxygen into your bloodstream so you can get the maximum amount of oxygen into that wound.
So it's not putting oxygen into the wound, it's putting oxygen into my blood, which enhances my ability to heal.
Correct.
Wow. And how often, if I'm having to go through a hyperbaric chamber, how often do I go into the chamber?
Every day.
Every day?
For about 2 hours.
For about 2 hours, and for how long does that treatment tend to last? How many days, weeks?
Typically goes on for 30 days to start off with.
Wow.
Yeah.
That's a dedication of some time.
It does. It takes a lot of time. Dedication.
Wow. But it works.
It does.
It brings back injuries that wounds that wouldn't otherwise heal.
Correct. Yes.
Wow. Very good. Well, AJ, is there anything else I haven't covered that I should cover to help our viewers out there understand how to recognize a wound, what to do about it, when to come to see you guys?
Yeah, the biggest thing I would say is if there is not a wound, just protect your skin, inspect, and if you have issues with diabetes, is to check your feet, have somebody, trim your nose, and if there is a wound, to actually contact us to evaluate, to see if there's a need for us to take care of that wound on a weekly basis to get it to heal.
So if you want to reach AJ, you call 281-341-3000 and ask for the wound care department, and AJ Jimenez will be there to take care of you. So thank you very much for joining us today, and I look forward to another Cup of Joe conversation about healthcare topics.